Health experts warned for months that the colder autumn weather would usher in a second wave of the coronavirus. That warning has become a reality as cases skyrocket across the globe. No country has had it worse than the United States, where each day sets a new record in case numbers. This month, the US is adding nearly 1 million new cases a week, with its total now past 12 million. Already 250,000 Americans have succumbed to the virus. And with the US presidential transition in turmoil, the federal response has been criticized as non-existent. The picture in Europe is equally grim. After being hailed for containing the virus over the spring and summer, much of Europe is doing worse than when the pandemic first hit. Several countries are under strict lockdowns, but there's some good news on the horizon. 2 promising vaccines could be available in just weeks. But it's expected to take several months before enough doses can be made for the general public. And joining me now from Geneva is Dr. Emanuele Capobianco. He is the Director for Health and Care at the International Federation of Red Cross and Red Crescent Societies. And also from Geneva, Torek Farhadi. He was a former senior advisor at the IMF. Gentlemen, welcome to Straight Talk. It's good to have you on the program. Globally speaking, Emanuele, is the second wave more devastating than the first one? And if so, why?
And the second wave is very serious, is still ongoing. The numbers are growing very rapidly. We have seen the mortality decreasing overall, but the number of deaths is extremely high. So it is a very difficult situation. It's a situation that is not over, that is being addressed, that requires even more efforts to bring it down and then to avoid the resurgence of what could be a possible third wave. So it's a long road ahead, unfortunately.
So what could you tell us about the lockdown measures placed across Europe, how it has impacted the daily cases?
Well, lockdown measures are never welcomed. They become a necessity when we have a failure of the test, the tracing, isolation system. And that's what happened in Europe over the summer, and so they became unavoidable. They are now making a dent in the outbreaks, and what we are seeing is initial signs in some countries like Spain and France that these measures are actually bringing down the numbers. And we hope those very difficult measures, necessary measures, will help bring this curve down and ending the second waves in the next weeks or months.
Yeah, so Torek, how critical was it for governments in Europe bringing strict restrictions back as the number of cases rose dramatically, and what kind of impact it would have on their already fragile economies?
Well, this lockdown, there were some lessons learned from the first lockdown. So, for instance, the borders are not closed within European countries. Travel is discouraged, but the borders are open. At first lockdown, the borders were closed, and Europe's economy is very integrated. France, Germany, very integrated economy. Switzerland, Germany, very integrated economies. And this time, they have left flexibility. So people who have to cross the border to go and work somewhere in another country of Europe, they can within the Schengen zone. So this is good because it has allowed the economic activity to stay okay. Where the economic activity has suffered is with small businesses. Governments have decided, for instance, to leave a large supermarket open, but a small store, a library closed. So people don't understand why they can go to a large supermarket, meet a lot of people with masks. But then a small store that could have managed 1 or 2 customers inside is closed. But when the store is closed, the store is not making money, employees are not coming, they are not getting salaries, and the store owner is not getting a rent.
Yeah, so Emanuele, now all eyes are set on the new coronavirus vaccines developed by Pfizer and Moderna. Is it safe to say that after almost a year later, we can finally see the light at the end of the tunnel?
Well, the preliminary information about these two vaccines are extremely encouraging. The efficacy levels that have been reported, more than 90%, are astounding, and we're hoping to get something that would work 60-70%. We're getting something that may be above 90%. But a couple of caveats. One, until the vaccine gets rolled out, we really need to maintain those adherence to critical measures, the social distancing, the washing hands, the wearing masks that we have been trying to really promote over the past year. And second, even when a vaccine will become available and hit the market, it will be very slow in coming in. It will be only available at the beginning for the health personnel, for a few older people, and so there will be a long way, particularly to reach those countries with that are middle and low income.
Yeah, so the priority will be the health professionals and then old people. But Torek, what kind of difficulties at the same time we could face in the distribution phase of those vaccines? I mean, will rich people and countries have it first choice, or will it be in everyone's reach across the globe?
Well, the WHO, the World Bank, and also large organizations such as the Bill Gates Foundation have said that they will make every effort to have a fair and equitable distribution of the vaccine. But we are in this before the vaccine for a few more months, and it's frankly an emotional elevator for a lot of countries, for people. There are mental health issues now. Yesterday night, the French health minister was talking about the number of mental health issues doubling, depressions. The other issue is that our capacity to adapt to all of this, with all the tracing apps, we have the impression to be under sort of a big brother surveillance system. Nobody likes it. Everybody understands it's important, but for those places where businesses are open, you have to put your name, your phone number, and this is all complications that we have to get used to. I don't know if it will last after COVID, but hopefully not.
So, Emanuele, what you just mentioned, one of the reasons that several European countries reimpose lockdowns is because of the tracking system failed. Why that tracking system failed in Europe, whereas it worked in several Asian countries?
These are very important questions. I think what we have seen was a very aggressive testing in many countries in Asia. And then very thorough contact tracing and isolation of the cases, and very thorough quarantining of all the contact. This is the system that will eventually end the outbreak and needs to be adopted at the local level. We need to ensure that whenever there are a few cases, then you can clamp down on those cases by ensuring that you isolate and quarantine. This is what was not done effectively in August, September, when the second outbreak could have been avoided. And this is what will be needed when we come out in Europe of this second wave. And if I can ask one point, involving communities, involving people will be absolutely critical. The apps are good, but are not enough to convince people to take those measures to stay isolated. And we need to support particularly the people that are asked to be quarantined economically and not only from a health point of view.
So Torek, let's talk to us about the United States. The US is right now going through a very chaotic presidential transition. The federal government seems to be missing in action as cases soar. So what impact could this have on the rest of the world, let's say?
Well, the first impact is on the US itself, where unemployment is still stagnating now. And if the lockdown lasts, a lot of small businesses will have to lay off people, and the packages that were supposed to be delivered by Congress because of political gridlock are not coming through. You have seen the images of cars waiting in front of food banks in the US. One of the things that we should know is these cars have loans. If somebody is waiting for food, they are not going to pay for their car loans. So next year we are going to see a lot of loan defaults, personal loan defaults in terms of car loans, mortgages, etc. for the rest of the world, yes, the US is an anchor economy. It imports from the rest of the world. So far, the imports have not been affected, and people from the rest of the world have been able to sell into the US. But services suffer everywhere in Europe, in US. Tourism, travel, these are areas that globally have around 100 million jobs
Yes.
lost, and we don't know when they will come back. And hotels, small hotels, restaurants, all tourism-related services like drivers, cars, limousines. And these businesses are small businesses, and when they don't have customers,
Yes.
they have loans to pay, and it's difficult.
Yeah, it seems that the governments will be forced to rethink and retool their policies in their countries once the pandemic is over. So, Emanuele, which countries got it right, which haven't seen a second wave or were able to contain it, and which countries managed to come out of this crisis economically successful?
Well, we have countries in Asia that have clearly been able to avoid second waves, from New Zealand to Australia to Japan, South Korea. We have a lot of countries that have actually been dealing well with the crisis. In Europe, almost all countries have been affected, but there are countries that have done better than others. Germany is certainly a country that, despite being the largest country in Europe, has been able to keep the debt lower than other countries. It's 11,000 in Germany until now versus 40,000 in France, UK, Spain, and Italy. So it's a huge difference.
Yes.
The point is we need to continue maintaining those measures that have been put them in place early, ensuring adherence, and then waiting for vaccines to come to hopefully help us getting out of this pandemic after a very difficult year for Europe and the rest of the world.
All right, gentlemen, unfortunately, we'll have to leave it here. Thank you very much for joining us on Straight Talk.